السلام ورحمة الله.
عليكم السلام.
السلام عليكم دكتور نادر.
عليكم السلام ورحمة الله.
Hello everyone.
Hello. Hello. عليكم السلام.
Hello everyone, كل سنة وانتم طيبين.
السلام عليكم. Okay, so hello everyone, and welcome to the fellowship. Those who are new, welcome. We're gonna start a new year. So before we do that, I think it's better to introduce yourself. So why don't I do that? I'm gonna ask we have a new group and we have the previous group, and I'm going to start with the previous group, batch 2, and then I'm going to ask the new group to introduce themselves. So basically, I want you to pronounce your name and how you want us to call you. Sometimes people write their names different and pronounce their names different. And if you can give us a little bit of background of you, just a fun fact or what you like for your goal or anything that you want to share, just make it brief. So I will start with maybe Hiba, according to my list here. You can just tell us something about you, Hiba. Go ahead.
Oh, sure. So my name is Hiba Walama, and I'm the second batch here in Telegeriatric Research Fellowship, and I'm almost graduated from the Telegeriatric. I enrolled into research. So my point when I enrolled first is to have an experience in research, particularly, and learn how to research, how to conduct research, and at the same time, how to be a good team player, honestly. To help me to enhance my communication skills during the interview season. So I'm very glad that, I hit my milestone by now. I achieved my goal, which is I was fortunate to secure a position in residency in psychiatry. So I think it's a great place to develop your communication skills, learn your basics in research, work in team, and learn from Dr. Nadir and from other colleagues tips like work for work or for your university. So that's my experience. It's very joyful, I would say, and beneficial.
Thank you so much, Dr. Hiba. And I'm gonna ask Dr. Avinash if you want to say something. Thank you.
Thank you so much, Dr. Nadir. Hello, everyone, and hello, new batch. I am Dr. Avinash. I am from the second batch of the Telegeriatric Research Fellowship. And I got, this is a very nice platform for all of we guys. We have to learn, and we will learn about how to conduct the research, how to collect data, how to write the abstract and manuscript. And this year I didn't match, but hopefully next year I will match with this help. Dr. Nadir is a very kind man, and he helped us in everything, in the research, in the residency, in the communication skills, and that's it. Thank you so much.
Thank you, Dr. Avinash. Maybe Dr. Ala Abdessamad.
Hello, everyone. My name is Ala Abdessamad. I am from Sudan. I graduated from the National Party University. And yes, I'm also the batch 2 in this Telegeriatric research. And actually, this research fellowship, it was really a great addition in my CV last year, which is make me to secure many of interviews. And each time I was asking about this Telegeriatric research. And yes, thank you, Dr. Nadir, for your mentorships. And hello, everyone, welcome for the new batch. And if anyone needs any help, we are here to help you. And feel free to reach out to me if you have any questions. Thank you.
Thank you so much. And maybe Lina. So I'm just going by the list on my right hand here, the participant. Go ahead. Lina.
Hello, everyone. I'm glad to welcome the new batch that's joining us. I'm Lina Alatta, a graduate from University of Khartoum, Sudan. I'm also from the second batch of Telegeriatric Research Fellowship. Actually, it has been a joyful year, actually, to be part of. I enjoyed the company of my colleagues, the supervision and the guidance by Dr. Nader. The environment here is very welcoming. We are here for each other. Each and every one of us has an ability to help you if you have any question. And I'm really looking forward to meeting each and every one of you in person. Thank you so much. Thank you, Dr.
Thank you. And maybe Muhammad Tijani, followed by Muhammad Ibrahim.
Assalamu alaikum, everyone, and welcome, third batch. Muhammad Tijani, second batch, Telegeriatric Research. Thank you so much, Dr. Nader, for such a great opportunity. And maybe to the best of my knowledge, I can be confident to say this Telegeriatric Research Fellowship, one of its kind. To have focused research or clinical research, focused program to learn about the clinical research, how to conduct, how to disseminate and share, building teams, communication, and definitely all of that come from the great mentor, Dr. Nader, and the support of the team. So guys, who just joined the third batch, you are very welcome, and this is a very welcoming environment to flare and to learn from each other, and I wish you all the best of luck. Thank you. Thank you, Dr. Nader, for everything.
Thank you so much. Muhammad Ibrahim. Yeah.
Hi, everyone, and welcome to the new batch. Muhammad Ibrahim, the second batch, graduated from University of Khartoum, Sudan. Before I joined this fellowship, I almost have zero experience about research. And with the mentorship of Dr. Nader and the group working as a team here, I feel that I now am more having more idea about how to conduct research and how to like have presentations in different topics that concerning research or concerning the clinical topics. So you are lucky guys to join this program, to join this fellowship, and with the mentorship of Dr. Nader. I'm not gonna say like anything that I can say now or comment now. It's not enough to say about Dr. Nader. So yeah, and so have a good time and have a fun, as I said. Thank you.
Thank you. Thank you so much, Dr. Muhammad Ibrahim. Perhaps Samah Ahmed. Go ahead, Samah.
Hello, everyone. My name is Samah Ahmed. I'm originally from Sudan, and right now I live in Canada. I graduated from Sudan, from Omdurman Islamic University. I'm second batch of this Telegeriatric Research. Welcome, everyone, and I'm sure that it will become very informative and useful year for all of us. Through my experience in this Telegeriatric Research, it was my first experience with research, basically. And really it opened my mind for a lot of information, for a lot of new things, and I learned a lot. Right now, at least, I find myself at least have an idea about what's the meaning of research, about conducting research and everything. Here we learned also the teamwork, the collaborative team, and the support. Even all people here are family. You can ask for help anytime, and you are welcome anytime. And as I'm sure that everything will be useful. Dr. Nader will not mention in front of him, but yeah, this basically after a few months, you will basically know that how the humble and collaborative behavior of the monitor will change our productivity. Best of luck for all of us, and hopefully this year all of us match next year. And welcome.
Thank you so much. Maybe we
So good evening, everyone. My name is Wi'am Mohammed. I'm from University of Khartoum in Sudan, and I'm so happy and thrilled to start this fellowship with Dr. Nader, and I'm from the new batch. So thank you, Dr. Nader, for providing such an opportunity for us.
Thank you so much.
Thank you.
Okay, maybe Tahani.
Assalamu alaikum, everyone. My name is Tahani Abujok. I'm from Sudan. I graduated from Shem University. We are so excited to have the new fellows today. So welcome to our team. Actually, this research fellowship really added a lot of skills to me, including the research skills, the teamwork, and the leadership. So I'm sure that everyone will benefit from it. Excuse me. I'm also I want to say thank you for Dr. Nadir for he's really kind man and very helpful. He always with us. Thank you, everyone.
Thank you so much. Maybe Tamadur, if she left. Usama, Dr. Usama.
Assalamu alaikum. Ramadan Kareem. Hello, everyone. This is Usama Ahmed from Buffalo University, batch 2. I think this is a great chance for everyone to know anything about research and some clinical knowledge regarding geriatric population. So we have a lot of topics that cover medicine and beside research. So this is a good opportunity for everyone to know the basic of research first of all, and then we can go further to population to have your name in any publication. So this is a good chance for everyone. And really, there is a good topic that covered during this fellowship, and we benefit a lot. And the good thing is we will benefit from Dr. Nadir, his moral and his everything. So he's a good kind of person. So we get a lot from him, and actually he's a good man. I hope everyone will get a lot of benefit from his knowledge and his behavior and everything.
So much. Thank you so much. Perhaps Lina, the other Lina.
Hello, everyone. My name is Lina Alatta. I graduated from University of Medical Science and Technology in Sudan. I'm batch 2 of Telegeriatric Research Fellowship. This is a great opportunity. You can get your own publications from this experience. You'll learn about how to conduct research, and well, definitely under the mentor of the Dr. Nadir. He's a great person and very helpful. I hope you all enjoy this experience. Thank you.
Thank you so much, Dr. Lina. Maybe Dr. Anna Al-Khadir. Anna, if you're not there.
I'm mute.
Sorry, do you hear me?
Yes.
Okay, I'm Nur Khadir. I graduated from Khartoum, and it was a nice opportunity I learned a lot from this fellowship. I get the basic learning of research. I and now I have a knowledge that how to do a paper, how to do publishing, and we learn a lot from topics we discuss every week. And also we gain a lot of skills like teaching skills, like leadership. So this fellowship added a lot to me actually. So I hope you will benefit a lot from it, and good luck.
Thank you so much. I don't see, maybe I'm missing. If anyone from batch 2 is there, I didn't mention the name, please jump in. I think that's
batch 2 are the new members.
Batch 3 is new numbers, and the members. Batch 2 is seniors now. Okay, I don't see anyone. So for the new members, the new fellows, welcome. And again, I'm gonna go by the list on my right hand here. But before I do that, maybe I can just give you a couple of things to consider. So when we started the fellowship for the medical graduates, mostly international, but it can also get involved with MS, with American students if they graduate and they did not match. But this year is unique because we have added other options or other areas to help us and help them. One of the area is physical therapy or therapy in general. So we have a therapist with us, and then we also have pharmacy, and we have dental. So I will start with these 3 areas, and then I will go back to the medical graduates. So if you don't mind, Mihir, he's a therapist here in Lansing. Go ahead, Mihir.
Sure. Hello, everyone. My name is Mihir Kumar Trivedi. I also prefer to go by Mihir Trivedi. I am a licensed physical therapist working in the Lansing area, and I'm one of the fortunate one to work with Dr. Nadir very closely in one of the nursing home. And I have done my bachelor degree from India, and I have done a doctorate of physical therapy in New York, Utica College. And I've been practicing physical therapy from last 15 years. And I've been doing practice in Michigan from last 10 years and 12 years, and also in geriatric area same time. And I've been very much involved in American Physical Therapy Association. I'm one of the state chapter director also, and also a state advocate for APTA geriatrics for Michigan State. And I have published one of the article in the APTA geriatrics GRE note regarding geriatrics cancer survivors and their physical activity and diet. So I'm here to learn more in detail and to enhance my knowledge and sharpen my skills in research. And also I'd like to learn from all of you and see how things goes. So thank you so much for giving this opportunity to me, Dr. Nadir. And I'm here to learn from all of you. Thank you.
Thank you so much, Dr. Mahir. We have from second batch, Dr. Abu Baida. Go ahead, Dr. Abu Baida. He jumped in and jumped out, maybe. So we have the pharmacy as well. I'm not sure, do we have that in the list or not? But we have dental as well. If anyone in these areas, please jump in.
Hello, everyone. My name is Siham Jaffer. I'm a pharmacist, graduated from University of Khartoum. I also have a master's degree in community pharmacy from Queen's University, Belfast. I also have a diabetes education, high diploma. Currently, I live in United States in Colorado. Now I'm working in Denver Health, which is the tertiary level hospital as a pharmacy technician, and I'm working on getting my license transferred to the United States. I'm also a candidate of MBA in health administration. I also have a published paper on medication adherence among cardiac patients in Khartoum State. I'm really excited to join this fellowship. I like to learn from all of you, and definitely from Dr. Nadir, the great person. Thank you, Dr. Nadir, for this opportunity. I'm happy to be among this great team. Thank you.
Thank you so much. We are glad to have you all. Maybe if Mayada, go ahead.
Hello, everyone. I am Mayada Mohammed. I am a dentist. I graduated from University of Medical Science and Technology, Khartoum. I live in Colorado, United States. I finished my national board, national dental board exam, and currently I'm doing my master's degree in orofacial pain and oral medicine in University of Southern California. I'm very glad to be here with you, and I'm very excited to be part of this fellowship. Thank you.
Thank you so much. Don't see Sahar. She's also a dentist, but she's not here. Are we missing anyone from pharmacy, therapy, or dental area list? If not, I'm gonna go again by the list here. Let's start with Abdel Hay. Maybe we'll start with A. Akhila or Akila. Go ahead.
Hi, Dr. Nadir. Thank you for this opportunity. I'm Akila Charakuri from India. You can call me Akila. And I'm a graduate. I graduated in 2019 from NRI Medical College in India. And I've done a few publications during my med school. But I'm really excited, and I want to learn more about the research. I want to know in and out of the research. So I feel fortunate to be part of such a team. And I want to congratulate everyone who had got into the residency this season. And I wish everyone good luck who are pursuing their residency path like me. Thank you for this opportunity.
Thank you so much. Welcome all again. Anjali, Adam. You're mute. So one thing you can do, if you have the computer in front of you, you can press the bar or the space bar, and then you can talk and mute yourself. Perhaps Ali Mohammedian. According to the list of the names appear to me, maybe the person behind is a different. So
this is, you hear me?
Yes, please go ahead.
This is Ali Mohammedian. I'm from Sudan, graduated from Cairo University, from medicine. I used to do like 8 years experience in the pain management in Saudi Arabia, and moved recently to the States, Virginia. I'm looking to get an experience in the clinical research to get the basic and the advanced knowledge in this field.
Sounds good. Thank you so much. If Abdel Hay is there, by Anjali Adam. If not, maybe Ali Raza.
Hello.
Go ahead.
Hello. Hello.
Hello.
My name is how are you? Well, my name is Mr. Bilawar. I graduated from University of Khartoum, Faculty of Medicine. Very excited about this opportunity. Thank you so much. I'm super excited to meeting you all. Thank you.
Thank you so much. Perhaps Amy.
Hello, Dr. Nadir. Hello, everyone. I'm Amy. I'm born and raised in Bangladesh, but I live in Troy, Michigan now. I have completed all my USMLE steps, including step 3. I did a publication last year, but I feel I need to learn more and about the research. And also I'm looking forward to improve my communication skill. And I'm so glad to be part of here in this wonderful team. And thank you so much for the opportunity, Dr.
Thank you. Thank you so much. And welcome all again. Maybe Madani, followed by Arij. Can you raise your voice? It's a little bit far.
Sorry for that. Assalamu alaikum.
Alaikum salam.
My name is Amina Madani. I graduated from Red Sea University in Sudan. Now I live in Virginia. Thank you so much for accepting me, and be happy to be here. Thank you. Thank you all.
Thank you so much. Arij.
Hi, everyone. My name is Arij Al-Shafi. I graduated from University of Medical Science and Technology in Sudan, and I currently live in Des Moines, Iowa. I joined this fellowship for 2 reasons. 1, because I have little to no experience with research, and 2, to strengthen my research or my CV so I can apply for the residency this year. So for everyone who's in my shoes, best of luck. And I can't wait to work with everyone. Thank you.
Thank you so much. Welcome. Ashwini, if I'm pronouncing that right, and Asjet after that. Go ahead.
Hello, everybody. I'm studying for the USMLE steps and trying to match. So this opportunity is very welcoming, and I accepted to learn more about the research, get some publication, how things go on, straighten up the CV. And Dr. Nadir has been very nice. He has explained everything to me. I'm glad to work with you all. Thank you so much.
Thank you. Welcome.
Assalamu alaikum. Hello, everyone. My name is Asjad Abdurrahim. I'm graduate from Durman Islamic University in Sudan. I'm so excited to join this fellowship. It is a great opportunity that Dr. Nadir provided to us. Thank you so much. I wish you good luck and success for everyone. Thank you.
Thank you so much. Bashair, maybe followed by Patran and Wadia.
Hello, everyone. Do you hear me?
Yes.
Okay, hello, everyone. My name is Bashair. I'm joining you today from Saudi Arabia, Riyadh, originally from Sudan. I am a medical graduate from Khartoum University. Thank you, Dr. Nadir, for accepting me, and I'm really excited to join you in this fellowship. Thank you, everyone.
You're welcome. And welcome, everyone. Go ahead.
Hello, Dr. Nadir. Hello, everyone. Thank you for this opportunity, for this great opportunity. I'm from living in Lansing, Michigan. I'm a graduate from Rabat University in Sudan, and I'm looking forward to working with everyone in research and improving my communication skills.
Thank you. Good to have you. I have Bushra and
yes. Hello. Yes.
Okay.
My name is Bushra Ahmed. You can call me Bushra.
Okay.
I have completed my MBBS from Sanaa Medical School. I worked at a GP for 2 years before I came to US. Now, currently, I'm living in Boston.
Welcome.
I'm so excited to learn from this fellowship. Thank you so much, Dr. Nadir, to accept me as a member of this team. Thank you.
Thank you. Welcome. Maybe we have to Dua. I'll start with Dua Nasruddin and then Dua Salah.
Hello, everyone. My name is Dua Nasruddin. Thank you so much, Dr. Nader, for giving me this opportunity. And I'm excited to work with everyone. I'm originally from Sudan. I graduated from Ahfad University in Sudan and currently residing in Florida, Jacksonville. And yeah, I'm looking forward to the opportunity. And again, thank you.
Excellent. Dua.
Hello, everyone. Good evening. My name is Dua Salah. I am a graduate from National University of Sudan. I've always tried to seek a good research program, and I was fortunate enough to find this fellowship. My goal is to learn how to do research in details and to sharpen my skills. And I'm very excited to join you all. Thank you so much.
You're welcome. Thank you, and welcome everyone. I missed BJ, if I'm pronouncing the name right. Shweta.
Hello, everyone. I'm BJ Shrestha, a medical graduate from Nepal. Thank you so much for making me part of this group, and I'm looking forward to learn about clinical research and enhance my communication skills. Thank you so much.
Thank you so much, and welcome everyone. I have Iman Day.
Yes, hello, my name is Iman Day. I'm a graduate of Bahri, University of Bahri, Khartoum, Sudan. I'm very excited to be here, and thank you very much for the great opportunity. I have 2 publications, but I'm very excited to learn and gain more skills and knowledge in research. And thank you.
Thank you so much, and welcome everyone. I have Farzana and followed by Fatima Nasr.
Assalamu alaikum everyone and good afternoon. I'm Farzana Rahman. I'm from New York. I graduated from Bangladesh. I finished my USMLE and I applied last year, but honestly, like I didn't have any research experience last year. That's why maybe I didn't get matched. I don't know. So I'm very lucky and I'm grateful to Dr. Nadir and my friend Dr. Ella. She basically helped me to know about this research thing. I didn't know that before. And thank you, Dr. Nadir, to make me a part of this group. Inshallah, I will learn everything and will apply residency this match with my research and everything. Inshallah. Thank you.
Thank you. Welcome. Go ahead, Fatima.
Assalamu alaikum. Hello everyone. My name is Fatima Nasser. I graduated from Sudan, and right now I live in Abu Dhabi, UAE. I'm really excited to join this fellowship, and I've always been interested in clinical research, but I needed more knowledge and guidance, which hopefully, inshallah, I will find with you, Dr. Nader, and the other seniors. And I hope it will open more doors for us regarding our careers and residency applications. Good luck, everyone, and I'm really glad to meet you all.
Thank you so much and welcome. I have Hassan Al-Haj and followed by Huzaifa.
Hello, do you hear me?
Yes.
Hello, my name is Hassan Al-Haj. I'm currently living in Virginia, here in US. Graduated from Cairo University School of Medicine. I worked as an emergency physician overseas in Riyadh, Saudi Arabia. Actually, I'm very glad to be part of this Telegeriatric Research Fellowship. I'm excited to learn and improve my clinical research, communication, and my leadership skills. And thank you, Dr. Nader, for this great opportunity. And thank you, everyone.
Thank you. Huzaifa.
Hi, everyone. My name is Huzaifa Saifuddin. I graduated from Omdurman Islamic University in Sudan. And currently, I'm living there. I'm working as a general practitioner for 2 years now. I'm so excited to join this fellowship, and thank you for this great opportunity.
Thank you so much. Thank you and welcome everyone. So I have Humaira, if I'm pronouncing that correctly.
Absolutely, that was correct. Assalamu alaikum. Hello everyone. I'm Humaira Kausar, and you can all call me Humaira. So basically, I'm a graduate, MBBS graduate from India, and I currently live in Chicago. So basically, I'm really excited to be here, and thank you, Dr. Nader, for this opportunity. And my main goal, I would say, is to become a physician for the community. And of course, the geriatric population really interests me. And by this research, I could obviously just add on research to my CV because I don't have that. And of course, improving my skills in research and getting a few publications. Happy to be here and glad to meet all of you. Thank you so much.
Thank you. Good to have you, and welcome everyone. So I have on the list Ibrahim Hamid, and then followed by Ihab Ahmed.
Hello everyone, my name is Ibrahim Hamid. I'm currently living in Sudan. I graduated from University of Imam Mahdi. Thank you for offering this opportunity to learn more about research, how to conduct research. Thank you, Dr. Nader. I'm really excited to learn more of all of you. Thank you.
Assalamu alaikum. My name is Ihab Ahmed. Graduated from University of Khartoum. I currently live in Cedar Rapids, Iowa, United States. And there is a lot of expectations, and I heard a lot about Dr. Nader, and hopefully we will learn a lot together. And Eid Mubarak for everyone. It's after tomorrow. Thank you.
Eid Mubarak. Thank you, and welcome everyone. So I have Isra, followed by Jitesh, if I'm pronouncing that right.
Assalamu alaikum everyone. My name is Dr. Isra Hamza. I live in Seattle, Washington, and I graduated from University of Juba. Now it's University of Bahrain. Thank you, Dr. Nader, for giving me this opportunity. And I know I will not only improve my CV, but I will also improve my clinical research experience, as well as my communications. I'm looking forward to work with everyone, and thank you again.
Thank you. Welcome.
Hello. Hello. My name is Jitesh. I did my MBBS from India, and I've always been interested in research, and I think that this is a great opportunity to learn a lot, and I thank you for giving me this opportunity. And hopefully this year, I'd like to match into family medicine. That's my goal. And yeah, that's it. Thank you.
Excellent. And we have Khulud from batch 2. Go ahead, Khulud. We missed you in the first round. You are muted if you started.
Hello everyone, Khulud from batch 1 or 2.
Oh, we have 2 Khulud? Okay, go ahead.
This is batch 1. You have a new Khulud? You can.
No. Oh, batch 2, sorry. I didn't drink coffee, so. Go ahead. Khulud, batch. Any Khulud.
Yeah, this is Khulud from the previous batch. I hope everyone will be have a great chance and opportunity to share his experience and to know about research experience and get more skills, communication skills. And I hope everyone will get this opportunity to and make it easy to have a residency or whatever you want to do. And good luck for everybody. And welcome. We are here to help you. If anything, you can contact us. And we are here from the previous batch. We just get wonderful experience with Dr. Nader and all the team. Thank you so much and good luck.
Thank you so much. And I have here Ma'arib, followed by Malaz Joda.
Assalamu alaikum warahmatullah. Hello everyone. Hello Dr. Nader. I am Ma'arib. I graduated from Khartoum University, Faculty of Medicine. And currently I live in United States, Wisconsin. And I'm so excited to be part of this research fellowship. And many thanks, Dr. Nader, for providing us this great opportunity.
Thank you. You're welcome. Melas.
Hello, everyone. Hello, Dr. Nader. I'm Malaz Joda. I graduated from Umdurman Islamic University. I'm currently living in Saudi Arabia. I'm from the previous batch. We were very glad to have Dr. Nader in the previous batch, and we are very happy to be with him in the next season and with you. We are always in help. Don't hesitate to contact us if you need anything. Thank you.
Thank you so much, Melas. We have Miriam and Maya. Go ahead.
Hello everyone. I'm Dr. Maya Advani. I'm graduated from People's Medical College, Nawab Shah, Pakistan, and I'm going to apply for residency 2023 March first time. Thank you so much, Dr. Nader, for giving me such a great opportunity. I am ready to learn things about research. This is my first time being in a part of research. Thank you so much.
So much and welcome. Maria.
Assalamu alaikum. My name is Mariam. I graduated from University of Science and Technology. I'm originally from Sudan, but I'm currently living in Maryland, Baltimore. Thank you, Dr. Nader, for this great opportunity, and thank you for everyone here who is helping, and hopefully we can, like me and the new and rest of the other, can do their best in this research and all things. Thank you.
Thank you so much and welcome everyone. I have Mason, if I pronounce that correct.
Yes, that's correct. Hello, everyone. I'm Dr. Mason. I currently live in Sudan, graduated from the National University in Sudan. I feel fortunate and grateful for this opportunity, Dr. Nader. I hope to sharpen my skills and researches and gain confidence, meet new doctors, learn from them. I think it's going to be a helpful and joyful experience. I hope it will help me secure a residency in internal medicine next year, inshallah.
Thank you. And I have a couple of Muhammads here. So I'll start with Muhammad al-Mujtaba, followed by Muhammad al-Junaid. Maybe Muhammad al-Tahir. Go ahead, Muhammad al-Tahir first.
Hello, everyone. Hello, Dr. Nadir. Thank you all. This is Muhammad al-Tahir. I graduated from the University of Khartoum, Faculty of Medicine. Currently living in Saudi Arabia. I would like to thank you for offering this great opportunity for us and accepting us, accepting me as a member of the new batch. I believe this is a great chance for all of us to learn a lot about clinical research, and this will help us also to sharpen our skills in communication skills and teamwork skills. Also, I believe this fellowship will help me to apply for the next residency and secure a position in an internal medicine. Thank you so much.
Thank you so much. And Muhammad al-Mujtaba, go ahead.
Yes. Hello, everyone. My name is Muhammad al-Mujtaba. I'm from Sudan. I graduated from Umdurman Islamic University. I'd like to thank Nader and everyone here for giving me this opportunity to be a part of this fellowship, which I believe would help me to more enhance my knowledge on research topics, and would probably help me secure a spot in the next residency season. I have done my Yosemite steps. I'm working currently on step 3. I have done a couple of researches before, and but I think I'm eager to learn more. And I could not have found any better chance than this to go forward with my research skill and knowledge. So thanks for everyone. And thank you, Dr. Nader, for giving the opportunity to be here. And I hope I can learn from each and every one of you. And I hope this turns out to be a very enriching experience, as I've heard from my colleagues who've been here before. So thank you.
Thank you and welcome. Thanks. The other Muhammad, go ahead.
Hello. Hello, everybody. Hello, Dr. Nader. First of all, I want to stress that I'm very delighted to have this opportunity. Thank you, Dr. Nader. Thank you very much. I hope that I'm going to benefit from this chance to increase my chances in matching in internal medicine program, inshallah. I am Dr. Mohammed Al-Junaid Al-Amin from University of Zaim Al-Azhari. I graduated in 2016. These days, I'm preparing for a step 3 exam. Hopefully, I'm going to arrange my time properly to fit all the needs of this research fellowship and to be as outstanding researcher in the near future, inshallah. Thank you very much, Dr. Nader.
Thank you and welcome. So I have Munia Al-Haddad followed by Monica.
Yes, hello everyone. My name is Munia Al-Haddad. I'm from Yemen. Currently live in Connecticut. I've graduated from Taiz University, Faculty of Medicine. So I'm from the new batch, and I'm so excited to be one of this amazing team. And yeah, as this is my first experience in research field, and thank you, Dr. Nader, of course, for giving me the opportunity to participate and learn from all the seniors here. Thank you.
Thank you. Welcome. Go ahead.
Thank you so much, Dr. Nadir, for giving this opportunity. And thank you so much for giving this opportunity for all international medical graduates, because it's very tough for everybody to get a research volunteer position in any kind of specialty. And also thank you so much, my peers and my seniors, because I already feel that I'm in a very good team, because so friendly and very welcoming. And me as my introduction, so I finished my MBBS, my graduation in India, and then I moved to United States, and I'm now in Florida. And I'm a former research fellow in University of Florida. So I had few publications, and I also did my abstract, a few abstracts and one poster presentation in Parkinson's disease. So my aim is to match in neurology residency. So I know a few basics about the research. So my aim here is to improve my writing skills and also learn about the statistics and learn about the software, our software and our SPSS, which we use extensively in research. So my aim is to push the team and push myself every day and week, meet the goals every week, so we can publish the articles, publish the papers as soon as possible, so that will help everyone to improve our CV and match the residency. So thank you so much for having me here.
Thank you so much and welcome all. Welcome. I have here Mu'tasim Idris followed by Nafisa. Can you unmute yourself?
Hello, Dr. Nader. Do you hear me?
Yes.
I'm very glad to be a part of your team, and thank you for giving me this opportunity. I hear about this fellowship from my colleague, as they told me it has helped them a lot in researching and publication and help them to get residency this year. And also they talk about how you are a good mentorship and help them to conduct research and to do better in their clinical. Thank you for being with you. Thank you.
Thank you so much and welcome. Nafisa.
Hello, everyone.
First, I would like to take the opportunity and thank Dr. Nadir for this opportunity. I really appreciate that. My name is Nafisa Mustafa. I'm originally from Sudan, graduated from National Ribat University. I currently live in upstate New York. I'm looking forward to work with you under your mentorship and all of my colleagues. Thank you so much.
I have Nouren Said, followed by Nikki.
Assalamualaikum, and thank you, Dr. Nadir, for giving me the opportunity to join this research fellowship. I'm Narin Sayed. I graduated from Dow Medical College, Pakistan, and I'm currently residing in Houston, Texas, and I work at MD Anderson Cancer Center. And I do have a few publications on my under my name, but I would like to have more experience in research, and my goal is to get match in the upcoming next year. Okay, thank you.
Thank you and welcome.
Hello, Dr. Nadir, and hello, everyone. And this is Nikki Shrestha. I'm originally from Nepal, and I graduated from East Medical College in Nepal. I'm currently calling from Virginia, USA, and I'm working as a medical assistant. I'm applying for the residency match this year, and I do have some experience in research with few publications, but I am very grateful for this opportunity, and I want to enhance my knowledge regarding clinical research and be a part of this wonderful team and learn a lot. I'm really excited. Thank you so much.
Thank you so much and welcome. So, Noura, followed by Omar Khalid.
Hi, my name is Noura Bushra. I'm originally from Eritrea, graduated from Cairo University in Egypt. I live right now in Toronto, Canada. I'm planning to apply for the residency, upcoming residency in US. My goal is to gain a clinical research experience to help me to match this year. Thank you for the opportunity. I'm so excited to work with you.
Thank you.
Hello everyone. Assalamu alaikum. Thank you, Dr. Nadir, for accepting me in this opportunity. I'm Dr. Omar. You can call me Dr. Omar. I'm from Sudan, graduated from Omdurman Islamic University, and I'm currently working and live in Abu Dhabi in United Arab Emirates. I heard about this fellowship from my colleague, and as I heard, it will be a great opportunity to add more skills, not only in the research, but generally in the medical practice. And thank you very much. I'm very glad to be part of your team, and I'm very excited to start work with you, everyone.
Thank you and welcome.
Thank you.
I have Osama Samad.
Hello, everyone, and good evening. My name is Osama Abdul Samad. I graduated from National Ribat University, School of Medicine. I want to thank Dr. Nadir for the opportunity, and I want to thank Dr. Alatta for telling me about the great program and for her help. And like some of you might know her, she's my sister, so I want to thank her, and I want to thank Dr. Nadir for the opportunity. And I want to thank everyone for the warm welcome, and I'm so excited to work with you all, guys, and good luck.
I have Kushimaya, or I'm pronouncing that wrong, I'm sure. Forgive me. You are far away, or your voice is not there. Satya, push me. Yeah. Sorry, we can't hear you still. can give you a couple of minutes and we will be back to you. I'm gonna mute you for now. If you can just try to fix your mic, and then we'll come back to you. Rawan Al-Haj.
Hey everyone, my name is Rohan Al-Haj and I'm a medical graduate from the University of Medical Sciences and Technology. First of all, I would like to thank Dr. Nadir for this wonderful opportunity, and of course, all the previous fellows. They were very welcoming. And I'm also excited to work with the new fellows in this opportunity. I'm very interested in neurology and family medicine, which are both fields of medicine that require plenty of research. And I think this would be a great opportunity for me to learn how to navigate through the field of neurology and family medicine research. Thank you, everyone, and happy Eid.
Thank you so much and welcome. I have Rawia and Rayan, if I'm pronouncing these names correctly.
Hello, everyone. My name is Rawia Fadul. I graduated from Nilan University. I also earned an MPH and a certificate in epidemiology from Benedictine University in Illinois. My goal is to gain and develop more research skills, and I hope I will reach my target by the end of this year. And thank you so much, Dr. Nadir, for this opportunity, and good luck for everyone.
Thank you so much and welcome all. Rayan Hassan.
Yeah, assalamu alaikum, everybody. My name is Rayan Hassan. I'm currently residing in Kitchener, Ontario. I'm a graduate of Ahfad University in Sudan. I'm really excited for this opportunity. I look forward to working with everybody under the guidance of you, Dr. Nadir, and I appreciate the opportunity that you gave us. Ma'assalam.
Thank you so much and welcome. I have another Rayan, Saleh, and followed by Rehan.
Assalamu alaikum, everybody. Good afternoon. My name is Rayan. I'm a graduate of University of Khartoum. First of all, I would like to thank you, Dr. Nadir, for giving us this opportunity. And I'm looking forward to work with you guys and learn more about research. Thank you so much.
Rehan, if you unmute yourself.
السلام عليكم ورحمة الله وبركاته. كل عام وأنتم بخير. I go by Riham. I want to thank you, Dr. Nadir, so much for this opportunity. It's so obvious that I'll be learning a lot through this journey, so thank you so much. And I hope I'll be a great addition to researches and upcoming projects. Thank you again.
And I have Rayan Mohammed.
Yeah, lots of Rayans. Hi, everyone. My name is Rayan Mohammed. I'm a graduate of the National Rabat University. I'm really happy to have some of my alumni in here. Thank you so much, Dr. Nadir, for this great opportunity. I'm really excited to start, and I'm happy to meet you all. Good luck with the next match, and happy Eid.
Thank you. I hope I didn't miss any Rayan or Rehan. If I did, let me know. Next one is Sahar Azaki, followed by Sari.
Hello, everyone. I am Sahar Azaki, a dentist, graduate from the University of Medical Science and Technology, Sudan. And also I have a Master of Public Health and Hospital Management from Sudan. I passed my national board exams, part 1 and 2, and currently working on orofacial pain and arm medicine masters at the University of Southern California. And thank you so much, Dr. Nadir, for this great opportunity.
Yeah, welcome all.
Hello, everyone. My name is Sally, originally from Egypt. I live in New Jersey right now. I graduated from Mansoura Medical College, finished my internal medicine residency in Egypt. I worked for the research field here for 1 year, and I also have a paper. But I usually work in the clinical board, not the stuff about writing papers and stuff like this. So I wish to know more about research, how to conduct research and write paper, and I wish to get this help from Dr. Nadir and my colleagues. I applied for match the previous year, but unfortunately I didn't match, and I hope to apply again this year. And my colleague recommended this fellowship for me and told me that it helped her a lot to get match and to get to know more about research. So thank you, Dr. Nader, for having me, and I hope to be a good candidate in the research fellowship. Thank you, and happy Eid al-Fitr.
Thank you. You're welcome. And I have Salma Ali from the seniors group and Sarah Abdalghani. Go ahead, Salma.
Hello, everyone. I am Salma Ali. I am from the previous batch. It was an amazing experience. Welcome to the new fellows. Reach out if you need help with anything. And thank you, Dr. Nader, as always.
Yep. Thank you so much.
Hi, everyone. Thank you, Dr. Nader, for giving me this opportunity. I'm so happy to join this group. So my name is Sarah Mohab, graduate of National Rabat University. I'm currently doing my rotation, internal medicine registrar at Stopa Hospital. My goal actually to know how to conduct research and to improve my communication skill. I'm so happy to join you all. Thank you.
Thank you so much and welcome all. I have two Sarahs, maybe Sarah Shafi and then followed by Sarah Trefi.
Hello, everyone. My name is Sarah Al-Shafi. I graduated from University of Science Technology in Sudan. I am very grateful for this opportunity, Dr. Nadir, and my senior fellows. I hope to learn a lot, improve my education and my knowledge, and this is such an exciting opportunity, and this is such an exciting community of fellowships. Thank you very much.
Thank you and welcome.
Assalamu alaikum. My name is Sarah Al-Trefi. I graduated from Khartoum University, a Faculty of Medicine. I'm currently residing in Minnesota in the United States. I'm very interested in family medicine and going into functional medicine, hopefully. And I was in the process of trying to find a research opportunity to be able to learn more about just like research from the start, from formulation the question, and then going on through it. Because I have been involved before in research, but always just in the middle part of it while just collecting data and following on patients. So that's when my friend told me about Dr. Nadir and this opportunity. So thank you so much for accepting me. Being part of this team, I'm very excited to learn from you and all the fellows here. Thank you so much.
Thank you and welcome all. I have Shahd and followed by Shima. Oh, Shima.
Assalamu alaikum. Hello, everybody. I'm Shahd Al-Azraq, graduated from Jazeera University, living now in Maryland. This is Maryland. First of all, I want to say thank you, Dr. Nadir, for accepting me. Your tele research geriatric fellowship, and thank you the previous batch for the great welcoming, and good luck for everybody. I'm looking forward to improve my research experience and communication skills, and thank you.
Thank you and welcome.
Hello, everyone. I'm Shaima El-Sheikh. I am a graduate of University of Medical Science and Technology, Sudan, currently living in Maryland. I have limited experience in clinical research, but I have a big passion towards the field. So I started a master program in clinical and translational research at George Washington University. And I'm about to start a new job as research assistant in first-in-human clinical trial facility. Thank you very much for the opportunity, and I'm looking forward to this new experience. And كل عام وانتم بخير. Happy Eid.
Thank you so much. I have Shaza.
Hello everyone, I'm Shaza Mohammed from Sudan. Currently live in Jacksonville, Florida. Thank you, Dr. Nadir, for giving me this great opportunity. I'm so excited to learn more about the clinical research and the communication skill. Thank you so much for everyone.
Thank you and welcome. We have Sulafa Mahmoud, followed by Shushma Sridas.
Assalamu alaikum. My name is Sulafa Mahmoud. I graduated from University of Jazeera, Sudan. Currently live in Virginia. So glad to have this opportunity and to be a part of this program, which will definitely expand my knowledge and will add a lot to me. Thank you for having me. Thank you so much.
Thank you.
Good afternoon, Dr. Nadir and everyone. I'm Sushma Srinivas. You can call me Sushma. So I'm a medical graduate from India, and I'm a psychiatry applicant. I had a few interviews last year, but unfortunately I didn't match. So I want to work on my CV and learn from Dr. Nadir and everyone else. I have some experience in research. I have published a few papers so far, and I'm working on a few more. But I want to enhance my research skills and improve my writing, as well as learn statistics and other tools. So I'm really excited, and I'm looking forward to working with everyone. Thank you once again, Dr. Nadir.
Thank you, and welcome all. And Sihan, is this Sihan the first one or Sihan Jafar?
Hello. Hello, I'm Siham Jaffer.
Go ahead.
I already introduced myself.
Oh, sorry. I thought this is another Sihan. This is why.
That's okay.
But welcome again.
Thank you.
You're welcome. So I have Tariq Muhammad, followed by Osman Habib.
Hello, everyone. You hear me, Dr. Nadir?
Yes.
My name is Tariq Muhammad. I'm from Sudan, graduated from Dongola Medical School. Currently, I'm working in Sultanate of Oman. Thank you for having me, Dr. Nadir, and thank you all my colleagues. And I hope all the best for all of us. Thank you so much.
Osman Habib. Alaikum assalam. So we have technical issues with your Osman. I think we have issues with the voice here. Maybe the net. We're gonna come back to you. Maybe we can try later. I have Yusra come back while Osman is fixing his mic. Yusra.
Assalamu alaikum. My name is Yusra Kambal, and I'm a graduate of University of Khartoum. I live in Phoenix, Arizona. Thank you so much, Dr. Nadir, for the opportunity to join the program, to work on my communication skills, clinical research, and teamwork. Glad to meet you all, and happy Eid.
Thank you and welcome. So I'm going to go back to Ushimi. If you are able to use your mic. Go ahead.
Hi, Dr. Nadir. This is Pushyami. I'm a graduate from India. Thank you for this opportunity. I'm very much excited to be a part of great team. And I would like to thank my friend Dr. Ala, who introduced me to this project. I hope I'll be learning a lot from all of you, and this will be a great addition to my CV. I'm trying for MASH the next season. Thank you, everyone.
Thank you, and welcome. So I'm going to go back to Abu Baida. Go ahead, Abu Baida. You just joined. And if Osman, if you are able to fix your mic, you can start. Osman Habib.
Assalamu alaikum. My name is Usman Habib. I am from Pakistan, graduated from National Medical College, and I'm preparing now for step 2 and will join 2023 cycle. I will apply for the match, and I am very glad to find opportunity and working with you soon.
Inshallah. Thank you. Welcome. We have a couple of other names here. Mabir Sheikh from the previous batch. Go ahead. Unmute yourself. Maybe she stepped away for a second. Abdul Hayy.
Hello. First of all, thank for Dr. Nadir. Abdul Hayy, graduated from Al-Zaim Al-Ashari in Sudan. Finishing my USMLE exam. I am preparing for next March. And this is a good chance for me to improve my communication and research skills. Thank you for Dr. Nadir or for other colleagues.
Thank you and welcome. We have Amro.
Assalamu alaikum, everyone. My name is Amro. I'm from Sudan, graduated from Faculty of Medicine, University of Khartoum. Firstly, I want to thank Dr. Nader for this great opportunity. I got to know from this fellowship from my colleague who encouraged me to apply, and despite I have a minimal research experience, I hope to be a great addition to this fellowship and an active team player. I applied to last March cycle, but unfortunately, I didn't match. So I trying to just strengthen my CV and my application, and I hope to learn from you, Dr. Nader, and everyone here. Thank you.
Thank you so much, and welcome. Anyone else I didn't mention their name here? Please jump in.
Yes, my name is Dua Mohammed. I am originally from Sudan, but currently live in Texas, Dallas. I have medical degree from Shandi University, Sudan, and I'm currently working as medical assistant in family practice. I'm very glad to be part of this team, and I really want to thank you, Dr. Nadir, for this opportunity. I'm really excited for it because I just really need to improve my communications and research skills. And thank you for all my peers and seniors, and I hope to do very good work together. Thank you very much.
Thank you so much, and welcome. Ayat, go ahead.
Hello, everyone. My name is Ayat Hashim. I'm a medical graduate from Al-Fashir University in Sudan and currently resident of Iowa City. I'm so glad to have this experience with you guys. Huge thanks to you, Dr. Nadir.
Thank you and welcome. Anybody else I didn't mention their name or they joined later. Go ahead, Ali and Mafaz.
My name is Mafaz. I graduated from Ibn Sina University, Khartoum. Thank you for this opportunity. I'm very happy to get to work with so many people on my research skills. Hopefully I can improve my skills as a team member and as a leader, and also improve my CV to get matched next year, hopefully. And I'm interested in hopefully pediatrics or medicine. Thank you.
Excellent. I see Al-Jali Adam and maybe Raza. Ali Raza, go first and then.
Assalamu alaikum. My name is Ali Raza. I'm from Pakistan. Thank you, Dr. Nader, for such a great opportunity. I heard a lot about you from my colleagues who was in your program before, and I'm looking forward to work with all of you. And best of luck, and we will ace this and we'll match, inshallah.
Inshallah. Welcome all. Maybe Al-Jali or Al-Jali Adam, sorry.
Hello everyone. My name is Al-Jali Hamid Mohammed Adam. Yeah, I am graduate of Khartoum. I am working in Abu Dhabi nowadays. Thank you, Dr. Nadir, for having me on board, and thanks for all the great members, and hope we will do well together. Thank you so much for the opportunity.
Thank you, Al-Jali. Anyone else? Anyone I didn't mention their name, please unmute and you can introduce yourself. I have the list, but maybe someone joined later. I have to miss anyone. Okay, Amal.
Hello, Dr. Nadir and other Amal Saad from Sudan. Graduated from Bahri University, now live in Chicago. I'm very glad to join research, and thank you for Dr. Nadir and others. Thank you.
Thank you and welcome. And I have another dua, if that's correct. Or go ahead, dua. No? Okay. I think that's all on my list here. If anyone I missed, please jump in. Dua, you wanna start?
I already introduced myself.
Yeah.
Okay,
So I thought, okay, you're welcome. Anyone else before we jump to the next section of the meeting? And you are unmuted. You want to say something? I'm gonna unmute you or mute you.
Hello.
Hello, go ahead.
Okay, today we are going to talk about diabetes mellitus. Dr. Lina Alatta.
Excellent. Thank you so much, Anna. So before Lina jumped in with presentation, so just to let the new fellows that we welcome you all and we work as teams. So the seniors will work with you and hopefully we can accomplish whatever goal you have. We have different goals. Some of you might be interested in geriatric, family medicine, internal medicine, or pediatric. The method will be the same. We want to obtain more knowledge, same as far as other disciplines like pharmacy or dental therapy. But we want to focus on the research part. Some of you might have a good experience on top of things as far as the research work. So we want you to help us, help those who are in the early phases of learning the steps or the skills for the research. So maybe during the meetings in the coming days, maybe we will talk about the basics. Just bear with us. If you want to add, if you want to contribute, please feel free. We learn from each other. The goal, again, is to learn the skills and knowledge in research, but as well as we want you to know something about geriatric medicine. That hopefully will help you guys either personally. Some of you might have parents, grandparents, and then when we talk about a certain aspect in geriatric medicine, maybe you can apply this concept to your loved ones, or if you are interested in pursuing geriatric medicine down the road, maybe this will help you as well. So without going into more details, we will divide our meetings into sections. One of them will be knowledge. I think the team will talk about diabetes in a second. And one part will be about the skills of the research. One part will be about other type of skills. And one part will be about the research projects that we want to start, or we started the progression, an update, and what's next, and so forth. So we need to be as efficient within these 2 hours. Forgive me, sometimes we go beyond the 2 hours. And we have some graduates from batch 1 who graduated and joined residency. Sometimes we invite them to come and join us with their input as far as their experience and what they found useful here, and so that you can apply the same concept. So I don't want to take much of your time. The team will start. Amna will lead the meeting from here on, and her team will present. Thank you.
Thank you, Dr. Nader. So today we have the learning topic about diabetes mellitus presented by Dr. Lina Alatta. Lina, go ahead.
Okay. So we will be talking today about, can you see my screen?
Yes, Lina. Lina, we can.
Yes, so we will talk today about diabetes in geriatric population. Okay, so our objective today will be to understand, to know and understand the consequence of diabetes in older adults, and how to establish a diagnosis of diabetes, and how to manage hypertension, dyslipidemia, and microvascular complications in patients with diabetes, and also to discuss the dosage and formulation of anti-diabetic agents. Okay, so epidemiology of diabetes in older adults. It affects about 15 to 20% of people aged more than 65. It's one of the most common chronic disease in that age group. Age-adjusted prevalence higher among Black and Hispanic American than white American. In the US, more than 40% of all people with diabetes are aged more than 65. Okay. Consequence of diabetes in older adults. So it's 10-year reduction in life expectancy, 2 more higher mortality rate, 2 more higher risk of atherosclerosis, neuropathies, loss of vision, and renal insufficiency, 2 more higher rates of MI, stroke, kidney failure, and 40% higher risk of blindness, 2 to 3 higher risk of mobility and disability, and 1.5 higher risk of disability in activities of daily life. Okay, older adults with diabetes are at higher risk than those without diabetes for geriatric syndrome, which include incontinence, depression,
cognitive impairment, urinary incontinence, injurious feels, chronic pain, and polypharmacy.
Sorry, Lina.
Yes.
We are seeing just your second screen. You are not moving for us. And it would be better if you click the icon of slideshow.
Okay, I am doing the slideshow right now.
We can only see the epidemiology slide.
Okay.
I think the second one.
Yeah, now we
here?
can see. Yeah.
Okay, thank you, madam.
Yes.
Welcome.
Okay. So, classification of diabetes. Can you all see this slide?
Yes, Lina.
Yes.
Yes.
So we have type 1 diabetes, which results from absolute deficiency in insulin secretion due to autoimmune destruction of pancreatic beta cell. Type 2 usually due to tissue resistance to insulin action and relative insulin deficiency. We have also type 3, it's due to injuries of pancreas, endocrinopathy characterized by excess hormone that antagonize insulin action, like growth hormone, cortisol, glucagon, and epinephrine. Drug or chemical-induced diabetes and infection that destroy beta cells. Okay, so now we'll talk about the pathophysiology of diabetes in older adults. About 90% of older adults with diabetes have type 2 diabetes. Diagnosis usually follows years of pre-diabetes. You can see glucose intolerance, insulin resistance, and metabolic syndrome. Pre-diabetes itself raises the risk of atherosclerosis. Prevalence of both type 2 diabetes and glucose intolerance increases age due to multiple factors, can be related to genetic, lifestyle, influence of aging, current medication, and intercurrent illnesses and other physiological stress. Okay, pathophysiology of diabetes, similar in younger and other adults, is due to prolonged hyperglycemia, can lead to protein glycosylation, accumulation of normal protein that lead to tissue damage. Hyperglycemia is accumulation of metabolic product of aldoreductase impaired that lead to impaired cellular energy metabolism, cell injury, and death. Physiological changes due to diabetes and its complication may interact with changes of aging to further degrade the physiological reserves. Okay, we have 3 ways to establish a diagnosis of diabetes. First, we have the symptoms of polyuria, polydipsia, and unexplained weight loss. Plus, if we have the casual or random plasma glucose more than 200 milligrams. Casual, which means any time of the day without regard to the time since last meal. Plasma glucose after 8-hour fast more than 126, or plasma glucose more than 200 milligrams, measured 2 hours after injection of 75 grams of glucose in 300 ml of water, administered an overnight fast. Okay, how we can interpret the borderline result? If we have impaired fasting glucose, which is fasting blood glucose between 110 and to 125. This is associated with increased risk of diabetes. And we have isolated post-challenge hyperglycemia. This is fasting glucose is not elevated, but many of these patients would be diagnosed of type 2 diabetes by oral glucose tolerance test criteria. This appears to increase the risk of atherosclerosis, although not much as type 2 diabetes does, but it still increases the risk. How we can evaluate older adults with diabetes? First, we have to evaluate the risk factor of atherosclerotic disease and parents of comorbid disease. We have to take the medication history and assess the functional status of the patient. Also, we have to screen for geriatric syndrome. We should ask of use multiple medication, depression, cognitive impairment, urinary incontinence, injuries, fall, and chronic pain. Assess the need for diabetes education and self-management support, and whether you should involve a caregiver. Okay. So here we have the goals of diabetes management. First, we have to we control the hyperglycemia and its symptoms. We evaluate and treat associated risk for atherosclerosis and microvascular disease. We evaluate and treat diabetes complication, support diabetes self-management and education, maintain or improve general health status. Okay, we have the general principle of diabetes management. Older adults should have the same opportunity as the younger adults for intensive diabetes management, reduction of risk-associated diabetes, and treatment of comorbid conditions. For some older adults, intensive management of diabetes and its complication is likely to provide benefit and maybe even harm. It's not likely to provide benefit and may be harmful. Diabetes management goals and clinical targets should be individualized. If you want to check how to prevent and manage the cardiovascular risk factor, we first have to counsel the patient regarding maintaining appropriate weight, increase their physical activity, stop smoking, and limiting fat and carbohydrate intake. We consider drug therapy to treat hypertension, prevent myocardial infarction, and treat dyslipidemia. Managing hypertension in older adults with diabetes. Our targeted blood pressure is 140/80 for most patients. Observational studies suggest a target of 130/70 may provide increased benefit. We have to lower the blood pressure gradually to avoid complications. Most antihypertensive drug classes have comparable effectiveness, but ACE inhibitors and angiotensin II receptor products have cardiovascular and renal benefit for patients with diabetes. Managing dyslipidemia in older adults with diabetes. Dyslipidemia should be corrected if reasonable, considering the patient overall health. We target LDL level less than 100 milligram per deciliter. If LDL is more than 130 milligram per deciliter, pharmacological therapy needed in addition to lifestyle modification. We measure ALT within 12 weeks of initiation or dose increase of statin or niacin. We measure liver enzyme annually after initiation or dose increase of fibrate. Preventing and managing microvascular complication. We do detailed dilated eye examination by eye care specialists at the time of the diagnosis of diabetes, and we repeat annually if exam detects retinopathy, other medical eye disease or eye symptom, or if hyperglycemia or blood pressure is poorly controlled. Otherwise, we repeat the test every other year. We do food examination at least annually for this patient. We test for microalbuminuria diagnosed and at least annually thereafter. We should give the patient the pneumococcal vaccine. So now we're going to the drug therapy of diabetes, non-insulin agents for treating diabetes. So we have our first drug, we have the second generation sulfonylureas. This drug may increase the insulin secretion and lower hemoglobin A1C by 1 to 2%. So we have glipramide, or they can call Amaryl in generic. The doses of the drug is 4 to 8 milligram once, and we begin with 1 to 2 milligram. This drug have the numerous drug interaction, and it's long-acting drug. We have glipizamide or glucotrol, which is the dose of 2.5 to 40 milligram. The patient can take it once or divide it. This is also it is a short-acting drug. We have glipizide, 5 to 20 milligram once, and it's a long-acting drug. We have glipizamide, it's 1.25 to 20 milligram once or divided, and it's long-acting drug which have the risk of hypoglycemia. We have micronazide glypride, 1.5 to 12 milligram once, and it's long-acting, which would also have the risk of hypoglycemia. Oral non-insulin agent, we have other drug class, which alpha glucoside inhibitors. This work by delay the glucose absorption, and it's lower hemoglobin 1C by 0.5 to 1%. We have the drug acropose. It's 50 to 100 milligram. We take it just before meals. Start with 25 milligram per deciliter. It has a GI adverse effect. We should avoid if creatinine level is creatinine clearance more than 2 milligram per deciliter, and we should monitor the liver enzyme. Miglatol, we should start with 25 to 100 milligram every 8 hours with first bite of the meal. Start with 25 milligram. It has the same adverse effect like sucrose, but no need to monitor the liver enzyme. The other class is DBB for enzyme inhibitor. It protect and enhance endogenous incretin hormones, and lower hemoglobin 1C by 0.5 to 1%. So the first drug in this class is called sitagliptin. The dosage is 5 milligram. We start with 2.5 milligram if creatinine clearance is less than 50 ml per minute. The other drug is sitagliptin. The dose is 100 milligram once as daily as monotherapy or in combination with metformin or sizodines 50 milligram per deciliter if creatinine clearance is 31 to 50 ml per minute. 25 milligram if creatinine clearance is less than 30 ml per minute. Okay, the other drug class is biogonides, which include metformin, the generic name of glucophage, which have the store of 500 to 2,550 milligram divided. We should avoid this in patients with more than 8 years unless the creatinine clearance is more than 60 ml per minute, or creatinine is more than 1.5 ml, or creatinine is more than 1.4 in women, heart failure, patient with heart failure, COPD, elevated liver enzyme, hold before contrast radiological study, and it may cause a weight loss. Metformin, or which can call glucophage XR, the dose is 1,050 to 2,000 milligram per deciliter. Okay. The other class is megalotidines. The first drug, it's worked by increase insulin secretion, and this class lower the hemoglobin 1AC by 1 to 2%. Netlagetine, which that has a dose of 60 to 120 milligram every 8 hours. You should give this drug by 30 minutes before the meals. Or ribaglantine, 0.5 milligram every 6 to 12 hours if the hemoglobin 1C is less than 8% or previously untreated. or 1 to 2 milligram every 6 to 12 hours if hemoglobin 1AC is more than 80% or previously treated patient. We should give this 30 minutes before meal, adjust dose at weekly interval, potential for drug interaction, caution in hepatic and renal insufficiency patient. If we want to use drugs in combination like glipizide and metformin, we should start by 2.5 to 250 milligram once, and then 20 to 2,000 milligram in 2 divided doses. We should avoid this in patients more than 8 years, creatinine more than 1.5 in men, or creatinine more than 1.4 in women. Okay, if we use glutamate and metformin, the dose is 1.25 over 25 milligram initially, if previously untreated. 2.5 to 500 milligram every 12 hours this meal, maximum 20 to 2,000 milligram. The starting dose should not exceed the total daily dose of either drug. The other drug, we have bigolitazone and metformin. The dose is 50 to 50 over 850 milligram every 12 to 24 hours. Ribaglitine and metformin, the dose is 1 over 500 milligram to 4 over 1,000 milligram twice every 12 or every 12 hours or every 8 hours before meal. Maximum dose is 10 over 2,500 milligram per deciliter. The other drug, we have rosiglitazone and glutamate, the dose of 1 or 2 tablets per day. Maximum is 8 milligram or 4 milligram. Rosiglitazone and metformin, it's 4 over 1,000 to 8 over 2,000 milligram in 2 divided dose. This should be avoided in patients more than 8 years, creatinine more than 1.5 in men, or creatinine more than 1.4 in women. Bigolitazone and glutamate, we start with 30 over 2 milligram, and the maximum is 45 over 8 milligram. Tigalstine and metformin begin with the current doses, and maximum dose is 100 over 2,000 milligram in 2 divided doses. So we have the other drug. Class is thiazolidinetones. It works by insulin resistance, reduce the insulin resistance, lower hemoglobin 1AC by 0.5 to 1, increase the risk of heart failure, avoid if NYHA class 3 or 4 cardiac status. Discontinue if the cardiac status in the patient decline. Bigolitazone, which is 15 to 30 milligram, and the maximum dose is 45 milligram per deciliter as monotherapy, or 30 milligram in combination with other therapies. We should check the liver enzyme at the start, monitor 2 months after and during the first year, then periodically. Avoid if the clinical evidence of liver disease or the serum ALT levels more than 2.5 upper limit normal. May increase the risk of fractures in women. Rosiglitazone, which is 4 milligrams every 12 to 24 hours. It has a higher risk of cardiovascular disease than bigolitazone and other oral hypoglycemic agent. Check the liver enzyme and start, and then every 2 months during the first year. Then periodically, avoid in clinical evidence of liver disease of the serum ALT is 2.5 upper limit of the normal. It may increase the risk of fracture in women. Okay, now we were talking about the injectable non-insulin agent for treating the diabetes. We have Exenite. The dose is 500 to 10 micrograms subcutaneous route every 12 hours. It's nicotine mimetic. It's lower hemoglobin 1AC by 0.4 to 0.9. Can cause nausea and hypoglycemia, less weight gain than insulin. We should avoid if the creatinine clearance is less than 30 ml per minute. Pharmalitidine, it's 60 micrograms subcutaneous immediately before meals. Its amylin analogs lower the hemoglobin A1C by 0.4 to 0.7. Nausea and hypoglycemia is common. It reduces pre-meal dose of short-acting insulin by 50%. Now we have the rapid-acting insulin preparation. We have insulin, Luisilin. Its onset started with 20 minutes and peak half and 1.5 hours. The duration of action is 3 to 4 hours. Insulin Lispro, its onset start with 50 minutes, peak in half and 1.5 hours, and the duration is 3 to 4 hours. Insulin Aspart, its onset starting 30 minutes after intake. The peak is 1 to 3 hours, and the duration of working is 3 to 5 hours. Regular insulin, its onset start to half and 1 hour, and peak in 2 to 3 hours, and the duration of action is 8 to 12 hours. We have the intermediate or long-acting insulin preparation. So we have NPH insulin. Its onset start 1 to 1.5 hours, peak in 4 to 12 hours, and the duration is 24 hours. We have insulin Detemir. Onset start 3 to 4 hours, peak 6 to 8 hours, and duration is 6 to 24 hours. We have insulin Glarine. The onset of action is 1 to 4 hours, and its duration is 24 hours. Isoform insulin, or regular insulin injectable, the onset of 30 minutes, peak in 2 to 12 hours, and duration is 24 hours. So now we will talk about the education and self-management support. If the patient is clinically complex, consider a referral to diabetes educator, disease management program, or specialty physician care. Annual diabetes self-management training is covered on Medicare Part B. Involve and educate a caregiver if the patient is cognitively impaired, significantly disabled or fair, or has limited proficiency in English. Okay. We should educate the patient and caregiver about hypo and hyperglycemia, precipitating factors, prevention, symptoms, monitoring, treatment, and when to notify the physician. Blood glucose self-monitoring when appropriate, diet and physical activity, the medication, purpose of the drug, how to take it, common side effect, and improvement of adverse reactions, and the food care. In summary, both diabetes and impaired glucose tolerance are important to identify and address. Because the great heterogeneity in older population, treatment goals for older patients of diabetes must be carefully individualized. So the target is debated, attempt to lower blood pressure as tolerated and important for older hypertensive patients with diabetes. Diabetes self-management is an important part of diabetes care. An annual self-management training is covered benefit under Medicare Part B. So we will go to the cases part. We have 4 cases. So we have an 82-year-old man living in nursing facility, evaluated because of gradual functional decline. He has lost 4.5 kilograms, which is 7% of body weight, since he entered a nursing facility 6 months ago, after hospitalization for acute myocardial infarction. During hospitalization, type 2 diabetes was diagnosed. In nursing home, he remained hyperglycemic with periodic glucose concentration spiking to 300 milligrams per deciliter. And recent hemoglobin 1AC level of 7.9 grams per deciliter. The patient is on American Diabetic Association low diet. He takes several medications, including glyphosate, varvastatin, hydrochlorothiazide, metoprolol, lisinopril, and aspirin. His laboratory result is creatinine of 1.4 milligram per deciliter, LDL of 100 milligram, HDL 34 milligram, and triglyceride of 170 milligram per deciliter. So which of the following is most appropriate next step management of this patient?
So can you please summarize the case?
Okay, again, you can see the case. It's in summary, an older adult of 82 years old. He's living in a nursing facility, has gradual functional decline. He lost 4.5, which is 7% of body weight, diagnosed with diabetes, and his glucose level remained high, even after he's taking these drugs. Lisomide, varvastatin, and this is his laboratory result, the creatinine level, LDL, HDL, and triglycerides. So how we can manage this patient? How we can do for this patient? What we can do for this patient?
I think liberalize his diet.
Anyone else?
Yes, for me, I think that we should start with his diet as a low carb diet instead of this a low fat diet. Then we will adjust the medications later.
Yes, that's true. We should start with his diet.
Yes.
Especially in older adult.
Yes.
Okay. Our next case is 72-year-old man come to the office for evaluation because he has impaired fasting glucose level. Fasting levels were between 110 and 120 milligram per deciliter on 3 occasions. He has well-controlled hypertension and his BMI is 29.5. Which of the following is most likely to prevent development of type 2 diabetes in this patient? Reduce caloric intake and increase physical activity to 150 per minute in a week. Increase physical activity and begin metformin or reduce caloric intake. What do you think?
I guess A.
A.
Others? Anyone else?
Yeah, I would say
A.
A.
Also goes A.
Yeah, A. I
Yeah.
agree with
Also,
A.
I'll go with A also.
A.
Yeah.
Yes, that's true. Excellent.
Yes, A. Lifestyle modification.
Okay. Our next case is 81-year-old woman is brought to the office by her daughter, with whom she has been living since the recent death of her husband. She's a former smoker and drinks socially. Her history includes osteoarthritis of the hip and knees, hypertension, incontinence, which has recently worsened and limits her willingness to leave home. She had a stroke several years ago that left her with some right-sided weakness for which she used a cane. Medication include ibuprofen, glycosamine, hydrocortisone, aspirin, a multivitamin, and since her husband is fluoxetine, she is allergic to lisinopril. Her weight is 90.7 kilogram, and her height is 1.65 meter. Her BMI is 33.4, blood pressure is 126/78, and her pulse is 70 beats per minute and regular. The patient has left carotid throat, slight weakness and rigidity in right arm, and leg with associated gait abnormality, and bilaterally decreased dorsalis pedis and posterior tibial pulses. Both feet have slight edema. She scores 29/30 on the mini-state mental examination and 11/50 on geriatric depression scale. This is her laboratory result. Fasting blood glucose of 165 milligram per deciliter, hemoglobin 1C 7.5 gram per deciliter, total cholesterol of 250 milligram per deciliter, HDL of 35 milligram, LDL of 140 milligram per deciliter, triglyceride of 200 milligram per deciliter, potassium level is 5, creatinine is 1.3 milligram per deciliter. Fasting blood glucose level 2 days later is 158. Urine analysis is positive for microalbuminuria. Which of the following medication is likely to decrease the cardiovascular risk of this patient?
We think it's C.
With Gaba is Valsartan.
C, yeah, C.
Yeah.
I'll go with C.
Any other one?
C.
C.
Why C?
Is it not
I
D?
will go with D
No,
because
D.
statins.
Yeah,
I also
Our blood pressure is already
lipid
controlled.
lower agents. You
Yes.
said
Yes.
hypertension is like a big thing with diabetes as well.
Yeah, what his age?
Yeah, but I think it's
81.
81.
I
it
think
should-
it's a D
I
because
think her-
can I speak? I
No,
think
it's-
it's D because it's the
should be.
diabetic patient and his age more than 40. So any diabetic patient after 40 years should have statins because this reduce his risk for cardiovascular disease.
Yeah.
Yes.
No, I think D is. I don't think it's appropriate because her age is 81, and after 75, you don't need a starting at least that high intensity statin. But Valsartan would at least help her renal function if it's okay. I don't know. It's
But
when you
her
get
blood
back.
pressure is
Can I add?
It's specific
If you
for
look-
cardiovascular.
If
Yeah,
you look
I know, but
statin
it's
usually started after
cardioprotective
90.
and renoprotective ACE inhibitors or ARBs. So both classes are shown to reduce adverse outcomes.
Yeah, but not at this age.
And I
Look
think
at
it's
that.
cardioprotective.
She has
What
a
is
lower blood
her-
pressure,
what is-
and she has a left carotid throat. She has a vascular disease.
She has atherosclerotic.
So
yeah.
for the valsartan, that the heart is protective by remodeling the heart, but but the statin is unknown reason. But the research that's showing that the statin it can have the cardioprotective properties, but the reason until now is unknown. But valsartan for remodeling, like it can benefit patients with MI.
Yes,
Yes,
or
yeah,
heart
we should
failure.
go with
Cardiac
this.
remodeling.
And I want to
patients,
correct
like
that the statin, you stop it after 90, not 8, not 75. So her
What?
age is appropriate. A statin that you stop it after 90, not after 75. So her age is appropriate for statin at this
I'm not
time.
saying stopping. I said at least not using high intensity. All I'm saying.
We should use statin to this patient because the patient has a stroke and evidence of peripheral vascular disease. So this is a threat to her health and independence. So she's on a risk of macrovascular complication. She's already on low-dose aspirin. Secondary prevention with further cardiovascular disease targeting dyslipidemia, the most immediate priority. The goal to reduce her LDL to less than 100. That's why we should use statin. Vartran can protect against further deterioration of renal function, but ACE angiotensin receptor blocker have not been shown to affect mortality in the patient with diabetes. Hence, addition of statins a higher priority here in this patient. Let's come to the ending of our presentation. Thanks, everyone.
Thank you, Doctor.
Thank you, Dr. Lina.
Thank you, Dr. Lina.
Thank you so much, Dr. Alina.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you so much for
Thank
the
you very
great
much.
presentation, and thank you for
Thank
the
you.
discussion.
Thank you so much, Dr. Lina.
Thank you.
Thank you, everyone. Thank you, Lina, for the great presentation. And I think you nailed it to the point. So diabetes is very important topic in older adults and in young population as well. But the key point here is you individualize the care for the patient. As we get older, we can have some comorbid conditions, and according to our excuse me, clinical abilities and lifestyle or life quality. So the goal might be different from one patient to another. If the patient is frail and they are not doing well and they have declining condition, the goal might not be to control their blood sugar tightly. You are not going to prevent heart attack in 5 years if they're gonna die in 2 years or 1 year. So your goal is not only to go by the numbers. You look at the patient, how active they are, what their goal, how can they tolerate things. So some guidelines for younger adults, and they can add certain medications for patients because of the criteria. If they have diabetes, they have cardiac disease, you just add 1 or 2 or 3 medication according to the guidelines. But in older adults, these guidelines might not work the same way. So we weigh the risk versus the benefit. If the patient is active, well, and we expect the patient to live, let's say, for another 10, 15 years, yes, we can go by the guidelines. If the patient is frail and going down and declining and not doing well, no matter what you want to achieve as far as a goal, as numbers or preventative goals, will not benefit this patient. On the contrary, you may harm the patient. So the first rule for medicine is do no harm. So in geriatric, we balance things out. So this is one of the key points for you guys. Thank you so much. Thank you, Lina. Any addition? Go ahead, Hassan, you want to add something? No, okay. Any other comments, any other questions, any?
Yes, Mr. Nader.
So go ahead, Muhtasim.
To my opinion, if we have an elderly patient, it's more than 70 and he just got the diabetes, we should consider a secondary cause of diabetes rather than to go for it is a small percentage, but it's not negligible. It's around 10, if I remember well. Usually they have cancer, pancreatic cancer, as a presentation of. So we should not think directly about type 2 diabetes. If you have a patient more than 75 and he initially just got diabetes, So we should consider to do an rather than the routine investigation for diabetes patient, we're doing a scan to shading for if they have a cancer, because the diagnosis is dangerous if we miss it and just diagnose him as diabetes and start him this. This is my opinion.
Sounds good. I agree completely. And again, you look at the patient and investigate as much as you can as far as you want to figure out what's the problem, what's the cause of the problem, and how can we solve the issue with that problem. So if in a case where you can achieve your goal of giving a healthy life for the patient, well and good, you can do all investigation that you want and medication and the guideline, you follow the guidelines. But if you catch a patient at the end of their disease, let's say if they have a pancreatic cancer, but they have metastasis, in that case, you might find the diagnosis or the cause for the problem, but you are not gonna be able to fix the problem if it's out of hand. On the other hand, if let's say you have a patient with high blood sugar, but when you took the history, they were started on steroids. So we know the steroids can increase the blood sugar. So one thing you think about is the medication. So if you remove the medication, if they're gonna stop the medication, let's say taper it down and stop it, then you hopefully will improve their blood sugar down in a couple of weeks or so. So it's not a diabetes or it's not a diagnosis like condition. So another fact about geriatric is we blame medication. So anything happens to the patient, older, 65 plus, think about medication. Are we causing the problem? Is the medication causing the problem? And if we can stop that, medication can solve the problem. So think about that when you practice, at least here in the US, as well as other places. So thank you. Thanks, Mutasim, for the addition. Any other? I know we passed the 2 hours mark, but we can continue for a couple of
I just
minutes.
want to comment on the diagnosis of the diabetes regarding the A1C. I didn't, I think maybe I missed it. Regarding the A1C in the diagnosis, she just mentioned fasting blood glucose 2 hour postpartum, I think, and glucose tolerance test. So what about A1C cutoff, and can we diagnose a patient with diabetes with only A1C more than the cutoff point?
Excellent. Why don't you give us your input? What do you think?
The cutoff, what I just know is 6.5. If it's more than 6.5, and since this will be a diabetic patient, maybe this according to the American guideline, and if it's less, it will be like pre-diabetic.
Excellent. So thank you so much for the addition and thank you for the comment. So basically, what we are doing, we have some slides already made, and the presenter will look at these slides and update as much as they can. So in the past, we used these 3 items that were mentioned in the slides, like you do the test of the 3 criteria. But in the recent years, we use A1C as additional criteria for diabetes. And the cutoff, as you said, maybe 6.5, or that's recommendations, and we can use that. And also we can use the A1C to modify our medications so that we can control the blood sugar better. The A1C give you a window of 3 months. In the last 3 months, what the average blood sugar for this patient, kind of. So it's gonna give you a picture of what's happening in the past. So if you want to lower that number, you may adjust either the dose of the medication or you want to add new medication to the list. But again, your goal might not be only lowering that A1C. It's a good practice for younger population. If you are a family member with patient in their 20s, 30s, 40s, yes, that might be your goal, is to lower the A1C. But as we deal with older patients, That's not should not be the goal, the only goal for you. You look at the patient as a whole, their quality of life, their abilities, their prognosis, put this all in mind, and then look at the A1C, if I'm making sense for you guys.
Thank you so much.
Any other comments, any other questions?
Yes, hi, Dr. Nari. I have one question.
Yes.
So, in the last 3 cases that the patient, all of them, they have been on glyburide medication, and as we know that for geriatric population, that they tend to have hypoglycemia more than hyperglycemia. I just want to know that if there is any guidelines that for, like to direct when we stop or switch from sulfonylureas medication.
So again, the guidelines, most of the studies are done in younger population, not done in older population. And there are some reasons for that. As we get older, we accumulate more than one disease. And in clinical trials, they want to have clean data. For example, they want patient with diabetes and heart problem. They don't want the patient with diabetes, heart problem, and kidney problem, and hypertension, and cholesterol, all this in one patient. It's not going to be a clean data for them, basically. It could be other reasons, but this is why when we look at the guidelines and the recommendation, mostly will be in younger patients. As we get older, things get complicated. So for the long-acting, let's say, lowering agent like the glipizide or other, usually we start them in younger population and they carry that when they get older. So again, the question will be, how are you controlling the blood sugar? If their blood sugar between 100 and 200, or if their A1C in the 7 area, then you don't want to change any of the medications. If their blood sugar is in the lower 100, in the range between 70 to 90, then you run into the risk of, hey, this patient, if they miss a meal with all this medication long acting, they may drop down further. So in that case, you will think, oh, this is not a good option for this patient. Although we controlling the blood pressure very good, but that might not be the good option for them because the risk is there. If it happens and the patient comes to you and tell you, I have this episode where I was feeling dizzy, sweating, and I check my blood sugar, it's in the 50s, and they are on this long acting, then definitely you should stop that medication from. You can use different medication that's short acting or with lower risk of hypoglycemia, if I'm making sense for you guys. Thank you.
Thank you. I have another question, if you allow me.
Sure.
Okay. So for the last patient that that we add the simvastatin, for the patient, as I remember, the age is 82. So at this point, it's better that to add the statin medication or sodium glucose transporter too. When as the patient, it has like a benefit for the heart and the renal as well. Even I think the patient has shown some signs of microalbuminuria. So can you just guide us like why we should choose statin instead of sodium glucose transporter 1?
So again, these slides, they have been made by the AGS, the American Geriatric Society, and we use them to educate ourselves and look at things from different angles. Basically, we want to look at the geriatric population. If you look at the younger population, you may have a different aspect or different perspective to the problem and how you manage that problem. Statin is one of the medications that's useful in certain population. It can prevent some condition or some complications. In this case, if the patient has diabetes and they have cholesterol, and you can add the statin to help the patient, that's well and good. And down the road, it will benefit the patient if we expect that the patient will live, let's say, another 5-10 years. If in this case, the patient was mentioning that he is declining or she's declining and losing weight and not eating and some we expect that the decline will continue. In that case, if you add the statin, it will be harmful to the patient. As we get older, the side effects of statins, let's say muscle weakness or liver enzymes can go up. All this can affect the patient if they have falls, risk of falls, if they have other medications that metabolized by the liver. If you add the statin, you may not give the benefit that you can get when you give it to younger population. So you think about what's the benefit for the patient. Again, in this case, I think the benefit might outweigh the risk. But in other conditions, the benefit of the statin might not be good or as good compared to the risk. Same goes with other medications as listed. So whatever you mentioned could be helpful for younger population, but in this case might not be as helpful. I hope I clarified the answer. Good question. Any other comments or any other questions? Good presentation. Thank you so much for sharing, and thank you for the questions and comments. Okay. Let's see, the chat has some other. No question in the chat or comments. Okay. So we can go to the next section. So Anna, go ahead.
No, I just want to introduce the next session. So, well.
Go ahead.
Okay, next we are going to talk about the telegeriatric outline and future direction, presented by you, Dr. Nader.
So, okay. So basically what we think we can do as a group, we can divide as we did in the past in teams. We will be working with teams. I want from you to think about what, if you are interested in coming up with an idea of a research. So maybe a research question. If you have any experience, maybe you will have some research ideas in the past, and you want to apply that, maybe you can just discuss that with us, and we can build up a project or a couple of projects in the areas that you think you are interested in. Some of you might be interested in areas, others might be interested in different areas. Let's say I'm interested in joining internal medicine, and after internal medicine, I want to do cardiology. Here from now, I built my resume according to that direction that I'm thinking about. I will be involved with research that involves the heart in older adults or something in that direction in these lines. Again, if every one of you is different, the experience, the skills you have are different. So let me know, we can work around this. And if we have, as we mentioned, some dentists in the group, we have pharmacy, we have therapy, all these disciplines, we can also work with them as far as projects, establishing some projects if you are interested in joining some of the group in these areas. And the goal is to learn the basics. If you have no idea, you go improve your skills if you have some. And if you are expert in some skills, let's say SPSS or some areas, maybe you can share, educate others. So these are the tasks that everyone will be doing in the next weeks, months to go. Hopefully the next year will be productive for all of you. I want you to decide your goals, decide your steps, the time that you want to spend with us. I know some of you might have other obligations. They have kids alive, and they might have tests coming or work or some other obligations. We understand that, but it's better if you communicate that with your team leader, that I'm not going to be available this week or I'm not going to be available this month, so that they will assign your task to some other team members so that we can get the things that we want to be done or task completed in a timely manner, if I'm making sense for you guys. So for these meetings, what we do is we divide into the knowledge, the skills, and the projects that we are doing, or the future project, or the plans as far as, let's say, we have accepted poster or manuscript, what the next step, who is going to do the presentation, how we can do that. And then polish on some of the skills. Let's say we will work on, as we approach the interviews time, maybe you want to practice interview skill, you want to be the interviewer or the one who answers the question. We want you to learn as much as you can. We will just provide you with opportunities. We will direct you. You will do the whole hard work. I wish you all the best, and I'm looking forward to work with you. So I don't want to keep you with us longer than this. Let's talk about next week. So what we do is we use the app. Okay, sorry. Monica has comment or question. Go ahead, Monica.
Yeah, Dr. Nadir. So I have some idea about some research project in my mind.
Sure.
When should I share it? So should I share it through a Word document, or can I share it when we are having the sessions on weekend?
So you can share it with, if you email me, that would be great. And speaking about next week, I think maybe we can start with that for next week. One idea of the meeting will be how we can ask the question about the research question, how to come with the ideas, and that maybe we can discuss about what ideas are there. If you have some, you can elaborate, and maybe you can have some team built on that area, and then we can start the next, like the steps of what we can do and dividing task. But send me an email. Thank you so much.
Sure.
So I'm gonna share the screen for next week. Usually we use the app. So if you log into the app, you will come to this join the meeting, or if you are unable to, here you can go to the upcoming Zoom meeting. So for next week, we will have the red team, I think, or brown team, sorry. We will have this so the topic about frailty, and then maybe the research question, and then we'll discuss about some of previous research projects and how we can use them, if we can, for next step, and then maybe about the new feature about Zoom whiteboard. So in Zoom, they have, in the last months or couple of weeks, they came up with this feature of whiteboard, and it's like 2 weeks ago we presented about Miro. It's a board kind of you put things around, and it's good for teaching, for presentation, for collaboration. So we can use the Zoom whiteboard. So if you want to familiarize yourself with this during the coming days, so that by the next week you will have an idea when we are talking about. So this is the agenda for next week. If you have any suggestions, shoot me an email. This will be assigned to the next team. Hopefully they will divide the task between them and see who will do what, and let you know, or just update the app where you can just put the name of whoever able to present. Could be one person, could be more than one person. If from the new batch you are interested to, let's say you have experience in doing the whiteboard, or experience with whatever in the task, please jump in, contact that team members and see if you want to contribute as well. if that makes sense, guys. All right, go ahead, Sarah Sheffield. You have a question?
Yes, I'm confused. Are we already divided into our teams?
No. For the new members and the batch 3, the new fellows, you are not assigned a team yet. So it's a work in progress. So in the coming days, you will be assigned to a team, and then hopefully you will have a team member. You might be a team leader, or you might be a team member in your team, but down the road we can switch the role for the team members between the team leader between the team. So you will have opportunity to be yourself as a team leader. Initially, we think the previous batch, the seniors, will be running the role for team leaders, just to make sure things are done the right way and you familiarize yourself. As we go along, you will assume some of these roles. So in the coming days, you will be assigned to one team. This is for the team work. So let's say we have two things: team as a team to work on this fellowship as far as learning and presentation and organization, as far as we identify tasks. So everyone will be ready and can jump in and share. But at the same time, this is one thing. The other thing, we will work on project team. So let's say Annie has a new project. She will advertise that, or will acknowledge, hey, I have this idea. So we'll put this for the group, and she will have some response from some of you interested in her project. So she will have a team, let's say 10 people interested in the project. We try to minimize the number. We don't want a lot of people in one project. So if 10 is approximately the number, she will be the leading or the project leader for that team. So the team for the project might be different from our teams. So we'll have two separate, one project team where will be led by the project leader. So she will identify who will do what. Hey, can you do the literature review? Can you do this? Can you print or do the PowerPoint for that project? Or can you present in the, let's say, conference? So this will be her team. We are talking about different things. So the first team is a team of the fellowship. You will be assigned team in general, and you might have a project where you have a leader for that project. If you come with the idea, you might be the leader for the project yourself. So I have a question here. Is it possible to get orientation session in research basics and tools? Okay, so we will talk about, yes. As we go along, we will identify areas. Let's say we will talk about the basics of the research. So the first thing is the question. Research question. How will you come up with the research question? This will be next week. Next step will be how to build the methodology. So we will talk about methods. So you have the idea, but how you can apply this idea into a research. Then we will talk about data, what variables you want obtain, and so forth. So it will be a stepwise approach. For some of you might be boring because you already know the basics and this, but I want from you to contribute, to give us your expertise, your knowledge in that. For some who are naive or novice in this area, learn as much and contribute as much to the learning process and participating or presenting, if that makes sense. Okay. We will assign leaders. So let's say the team will be composed of 10 and they have the leader. So the leader will contact you, the 10, and then you will decide as far as communicating between you guys. In the past, they use WhatsApp as a communication platform. If you use that, that's very good. If you prefer to use emails or other way of communication, that's also an option. And we have another one. Some suggestion about leadership skills. So it's, again, we can talk about that down the road. One of the topic will be leadership, but we want you to learn the skill as much as you can. Sometimes you learn when you apply it. So if you don't become a leader yourself, no matter how we present, talk about, it's not gonna sink in unless you play the role yourself. So put that in mind or think about it. Thank you. Any other questions or any other comments? I know we have a lot to learn, and we don't want to put all stuff at the beginning because it's going to be overwhelming for you guys. But we want you to, if you can, take it bite by bite or a small chunk. If you are expert in the area, please contribute as much and see what area you want to improve on. There is always room for improvement, no matter what. If you have time, you can get in more than one research project. If you are, let's say, preparing for step 3, we assume that you will be busy, and we want you to focus on getting a good mark and passing that because it's important. After that, if you have time, you can join and work in one or more projects. The requirement for you guys is to finish at least one project by the end of the year. I hope everyone will be involved in some way or shape in a project, maybe more. And then we will see if we can produce things out of these projects. In the past few 2 years, we were successful. We have, let's say, 30 plus let's say presentation or abstract or posters that we contributed or we submitted. We were successful in securing 26 or 24 that were presented, that means accepted and presented, and some of them were presented in more than one conference or annual meeting. So that is a very good turnout, or we are very successful. And that's, I'd like to thank the teams, previous teams, batch 1 and batch 2. They worked very, very hard to get this done. And I'd like to thank you all for that. There is a question here about reference online site to review topics. So we will talk about that, and down the road you can learn more. Again, if you have questions, try to reach out to your seniors or the one who are, like, say they have experience in certain areas. You can just shoot them an email or contact them, and then they can guide you. There is one more question here about the email ID from MSU. Unfortunately, they give it to either employee or students. This fellowship is not recognized by the government, like it's not validated by, we started as an idea and a proof of concept. So we started with 5 positions just to make sure we can show funding opportunities and the university and other organizations that this is helping not only the learners. In your case, you are the learner, but also it's gonna help the future of the US. As we know, the population is increasingly aging. So we started with 5 positions. We increased that to 16 first year, and second year we start to accept more positions. So we ended up with about 50, 40, 49. We were fortunate to have some support, some funding from MSU regarding the geriatric. So we were supported as far as registration for the conferences, and if we did not participate in person except for one meeting, but they supported that person to present in person. Most of the time we presented online, so the expense was less expensive compared to in person. We will seek further funding for this program. We're still in the process of writing and seeing if we can secure some. Again, if you want to have an ID, let's say MSU ID email, you have to become a student. To do that, you are already graduates, so you can apply to a graduate course. There is some courses that actually I took 3 of them in the last year about leadership, one of them, organization skill, another one. There is a third one. Each one can cost around roughly $1,100, like $1,100. It's 4 weeks course. If you want to join this, it will enhance your skill as far as let's say leadership skill or some other skills, and you can put that in your CV. But doing so, you will be a student, and you can get your email from MSU. So your email ID will be MSU. It will benefit you when you communicate with other programs. It's not like Yahoo or Gmail. I'm not saying this is bad ones, but when you have affiliation with organization, your application might be looked at differently. So this is something that you think about. We have a question here. I want to go about the grand rounds. Okay, so we have grand rounds. We have MSU and Espero Hospital. It's a local hospital for internal medicine. They do bi-weekly grand rounds, different topics in internal medicine. So it's virtual, so you just log in, similar to what we are doing now, and we can share with you the link for that. So it's going to be helping you to get update as far as what they are doing in internal medicine. There is another group who does, like, they run grand routes in neurology. That's usually on Fridays morning. In the past, they used to have grand round and case presentation in neurology, but I think they are doing now only the grand round. So we can share with you that link as well if you are interested in neurology. If you have other communication or other areas where you want to let us know. Let's say some of you might be interested in psychiatric. So maybe we can reach out and see if there is any grant out in psychiatry and so forth. So you will have some idea about the ongoing process, the clinical aspect of things as well. Good question. Any other questions or comments that I missed? Or once more, thank you, everyone. If there's any question, please shoot me an email. If none, we will see you next week, and the team will be working on getting things organized for the next session, next meeting. And expect an email from me. We will divide you into groups or teams. Hopefully we will work together, and I'm looking forward to enjoying the next year with you guys, and I wish you all the best. Thank you. Happy Eid, and have a nice day or night, wherever you are. See you next week. Assalamu alaikum.
Happy Eid, Doctor.
Thank
Happy
you.
Eid all.
Happy Eid.
Thank you.
Happy Eid.
Assalamu
Thank you
alaikum.
so
Thank you so much,
much.
doctor. Thank you.
Thank you.
Thank you.
Happy Eid, everyone.
Thank you.
Thank you,
Thank you
everyone.
all.
Happy
Happy
Eid.
Eid.
Thank you so much, Dr. Nader.
Thank you. Ala, on the summit, if you can stay for a second.
Oh, thank you. Yes, I'm here.
Thank you, everyone.
Thank you so much, Doctor.
Thank you. See you next week.
Thank you, Dr. Nader. See you next week.
Thank you.
Thank you. We'll see you next week.
Have a wonderful day, everyone.
Thank you, Dr. Nader.
Thank you,
Happy
Meher. Happy Eid. Thank you. Have a good one.
Thank you,
Yeah.
Dr. Nadir, and Eid Mubarak.
Thank you, Dr.
Thank you,
Nadir,
Ryan.
and thank you, everyone.
Thank you,
and
Dr.
happy Eid,
Nadir.
everyone.
Thank you, everyone.
Thank you so much, Dr. Nadir.
Thanks and happy Eid.
Thank you, Dr. Nadir.
Thank you. So, Ala, I got your email regarding the both teams are not able to, any one of them, right?
Yeah.
That's fine. So I want you to focus on step 3. Don't worry about it. We'll see if there is anyone else from the other team would like to present, work on that. If there is someone identified, maybe they will reach out to you. If no one available to do that, I will see. I'm flexible, but I will see if I can go and present that. If all we cannot do and present, that's fine. We will only present it as a virtual. So sounds good.
Okay.
Let me know. Did you work on the poster?
Yes, I'm working on it. Just
Hello?
recently, I didn't finish it yet.
Hello, Muhammad. Yeah, so if you work on that, and let me
Yes,
know.
I will work it and finish it in a weekend, hopefully.
Hopefully, yeah.
Yeah.
I think they said the deadline is the 10th or so.
Yes, May 10th, yes.
So, yeah.
Otherwise,
it's-
Dr. Nadir, I can go. It's okay, just a one day I can go on site and present it. Because this is the work of others. I don't want to to miss the working for others. So I think so I can go.
Sounds good. If it's not gonna affect your preparation, and, that's well and good. So work hard on the roster. Let me know if you finalize your thing. Let me know, and we will take it there. For the registration and the cost for the hotel and so forth, we'll talk about that, and we can cover that. I think we have.
Okay, that's great. Okay, thank you, Dr. Nadir.
You're welcome.
Appreciate it.
No worries. Thank you so much. I appreciate it. Have a wonderful day.
You too. Bye-bye.
Thank you. Anyone else in the group that's still there? Have any questions or comments?
Just want to thank Dr. Nadir for the opportunity, and happy Eid.
Thank you so much. That was happy Eid. Eid Mubarak. Go ahead. I think Sarah or who?
Doctor, I'm just wondering, have you stopped accepting any more new application?
Yes. So we want to limit it as much as we can. I know there are, if by the numbers, I think we have 8,000 international graduates that, at least from the website, that did not match. So if we open it all the way, it will be unmanageable. Do you have someone in mind, Sarah?
Actually, it's someone who's already applied to you, and you've replied to her, but you haven't set up a meeting with her, an interview, and she was just waiting for you. And she knew the meeting was today, and she didn't want to miss it. So
Okay, all right. If you can just send me an email with the name, that would be great. I'll get in touch with the person.
Okay, thank you very much, Doctor.
You're welcome. Thank you.
Happy Eid Mubarak.
Happy Eid Mubarak. Okay. Anyone else have any question or has any question, comments, or anything unclear for you? If not,
No, thank you.
Yeah. Thank you so much.
Okay,
Dr.
thank you.
Ala.
Okay.
Have
Thank you.
Eid Mubarak and my side.